After being continually frustrated with his experience with the pharmaceutical industry, our next guest is building a game-changing company that delivers prescriptions straight to a patient's location with a simple tap of a button. Eric Kinariwala, CEO of Capsule, joins us to discuss why and how he and his team provide consumers with the simplest and easiest way to manage their medications. Additionally, Eric outlines why the pharmacy serves as the highest interaction point in healthcare and how Capsule has become a trusted brand that consumers and providers can rely upon during their healthcare journey. Join us to learn how Eric and his team are rebuilding the pharmacy industry that enables customized outcomes for doctors, hospitals, insurers, and manufacturers. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Eric, a huge welcome to our podcast. I'm thrilled to spend time with you today.
Hey, Mike, it's awesome to be here with you today.
Well, given your passion to shape the future of pharmacy and how you're pioneering a better and simpler experience for consumers across the nation, I'm honored and looking forward to this important conversation. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn, Twitter, and Clubhouse in order to further the conversations occurring on this podcast. All right, Eric, it's almost time for our community to learn how you and the Capsule team are rebuilding the pharmacy industry from the inside out with an emotionally resonant brand and technology that enables customized outcomes for doctors, hospitals, insurers, and manufacturers. But before we dive into all of that, Eric, what is that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
I think the best piece of advice I have, if you're going to jump off the cliff and start a company, is to make sure your head and your heart are aligned. So make sure that your heart, like you really understand the consumer or the customer pain point, and you have this deep, visceral understanding of what that is to tide you over the inevitably difficult times that are the ups and downs of starting a company. And make sure your head is aligned. You understand the industry you're getting into. You understand the problem space. You understand how you can build a good business out of it. And I think when those two things line up together, really amazing things can happen. And so I would encourage everybody to find the place where their head and their heart are aligned. And then when that happens, run really, really fast.
I love it. And I think we can both agree on this, Eric. You just can't go and start or think you're going to go and start a company because, hey, I'm going to make $1 billion. If you're going off that and jumping off the cliff with that in mind and not having, like you said, that deep visceral connection to the problem you're solving, it's going to be a tough slog because you know as well as I do, there are a lot of ups and downs through this journey, and you better be ready and strapped in, and you better be fully dedicated and all in with every fiber of your being. Is that the truth or what?
That is the truth.
I mean, it is tough. You got to bring your A game. You got to bring your full self every single day to this. It sometimes can be a lonely place as well, as you know, but man, if you know that it is part of your fiber and well-being, it is amazing what one can accomplish. And of course, Eric, we're going to talk about all of that. You guys have been after now for some time with Capsule. We got a lot to discuss. I can't wait to dive into the journey, how it all came to be and hearing where things are. But we are going to go and thank our community champion sponsor and hear back from you after this break. Located in Denver, Colorado's nationally ranked River North District, Catalyst is a healthcare innovation campus that brings together stakeholders from across the industry to accelerate innovation and drive real, lasting change our nation desperately needs. From established organizations to startups, from accelerators to advocacy organizations, and from medical schools to global companies, everyone at Catalyst works side by side to create, develop, refine, and bring to market cutting-edge innovations that will fundamentally transform healthcare as we know it. With industry leaders like Medical Group Management Association, Olive, Medical Solutions, UC Health, CirrusMD, and many others calling Catalyst home, along with innovative pioneers visiting from across the nation, Catalyst continually fosters their foundational belief that collaboration and partnerships will move the healthcare industry forward. To virtually tour Catalyst and claim your space on campus, or host an upcoming event, visit catalysthealthtech.com or visit the top of the episode notes and click on their link. All right, we are back with Eric Kinariwala, CEO of Capsule. Eric, thank you so much for being with us today. We have a lot to unpack. You weren't a serial entrepreneur in healthcare. I love that. We need new, fresh thinking in this industry to move this industry forward. We have a lot to reimagine in healthcare, as you know. So give us a little bit of that founder's journey, how Capsule came to be in the first place, where you guys are, where are things at in the marketplace, where are the successes, the messies in the middle, right? Building a company isn't always just roses and wins. There's a tough times as well. So give us a current state, how things are going, where you see things heading, of course, where we can be helping you out as well. But first, take us on that journey, Eric. How did this all come to be in the first place?
It's a great question. I was living in New York City in the winter of 2015, and I woke up one morning with this killer headache, and I called my doctor, and he asked me a series of questions, and basically, don't worry about it. You've got a sinus infection. I will call a prescription and go get it. And I was like, perfect. And so I put on a coat and went out on this snowy January day to a chain pharmacy around the corner from my old house on the Lower East Side of New York. And long story short, everything you can think about going wrong with the pharmacy went wrong for me that day, starting with the fact that I couldn't even find the actual pharmacy part of the drugstore and meandering through the store past aisles of cigarettes and candy bars and greeting cards. And finally, someone points me to the basement. And so I get to this dark, dingy basement on a broken escalator. And there's like 30 or 40 people in line ahead of me. And, my cell phone's not getting signal down there. And I end up waiting in line for an hour. I finally get to the counter and the pharmacist, says, "Can I help you?" And I said, "Yeah, my doctor called in a Z-Pack. Can I get it?" And she kind of has this really despondent look on her face, clearly overworked. And it's like, "I'm really sorry, we're out of stock." And so I'm like, "Hey, it's January. Like, how are we out of stock on Z-Packs? It's kind of the only thing you should have." And so I said, "Hey, don't worry about it. I'll just call my doctor. I'll have him write it in somewhere else." And as I pulled my phone out of my pocket to call my doctor, I realized my phone had died, searching for signal in the basement. And so I ended up going home, no medication in hand, and went to bed. And I woke up the next morning and I had one of those moments I think a lot of entrepreneurs have, which was just like, what is going on? How does this all work? And I just started unpacking my own experience. And I just started asking these very, very fundamental questions. Like, what is a pharmacy? Why are there so many? How do they work? Why do they sell Twizzlers? And what I came to realize was really three things that we've built the foundation of our business around over the last 6.5 years. The first is that, wow, unfortunately, my experience at the pharmacy wasn't exceptional. It was par for the course. And wow, there's this enormously big category. It's 70,000 pharmacies and second largest category of retail in America. And it's $400 billion. And, it's 1% online. And learned all these crazy stats. Like 40% of the time people go to their pharmacy, their medication's out of stock. And the average wait time's an hour. And the NPS is the same as Verizon or worse, or your favorite cable company. And so kind of long story short, this massive category, 70% of American adults go to the pharmacy once a month, touches everybody. It hasn't changed in 50 or 100 years. And it leads to this really big problem, which is it's not just inconvenient. 1 out of 2 prescriptions in America goes unfilled. So that was kind of the first learning around the pharmacy. And the second thing that I learned that we've really, I think, spent a lot of time in trying to understand and build our company around and our product around is like the pharmacy is the most frequent interaction point in the entire healthcare system. That's a really unknown, under-harnessed, powerful thing. And so I think my belief has always been a lot of companies in healthcare have the same goal, which is how do we deliver better healthcare outcomes at lower costs? And so the question is like, how do you do that? Where do you do that? And I think my view has been that for us to do that, people need to make better, different decisions about their healthcare. And they need to trust the information and advice they get. And trust is a function of how frequently you interact with somebody and how many positive repeat interactions you have. And so that's kind of the second thing. And then the third thing, which I think is the most interesting thing about Capsule, candidly, which is that, I came out of this bad drugstore experience and I just started talking to friends of mine. I was like, "Hey, you ever been to the drugstore? Like, you ever been to the pharmacy? What's going on?" They're like, "Yes, it's terrible." I'm like, "Got it, check." And then I started talking to friends of mine that were physicians. And I'm like, "Hey, what's your experience with the pharmacy like?" And they're like, "Eric, if you think it's bad for you, think about me and my staff. We interact with the pharmacy 20 or 30 times a day." And then I started chatting with folks that ran, health insurance companies and health systems and drug companies. And all of them started sharing the same thing, which is the way the system's set up isn't set up to help me take care of the people I need to take care of. And so that's really the foundation of our business. And the mission of the business is to build a pharmacy that works for everyone. And of course, that means for the 70% of American adults that go to the pharmacy once a month, but it's really the pharmacy as a partner to the doctor, to the health system, to the hospital, to the insurance company, to the drug company, to help all of them be more clinically and financially successful. And that's where we started. So it was me in a room by myself in a WeWork in the financial district. And we spent the first year building out the team, the technology platform, the brand. We built a physical pharmacy, regulatory permits, all that good stuff. And then we launched the business here in New York with our first product offering in May of 2016.
I love it. And thank you for that, Eric. And we're going to, of course, ask you the elevator pitch, which I know you've given 1,000 times, really, share with our community exactly what Capsule is and what it means for all the stakeholders. But I have to ask, I think it's a fascinating one, right? So historically, Eric, you were an investor, right? You were investing in companies, that were working to transform healthcare. Did you have it on your roadmap that you were going to be a founding operator of a startup?
I didn't. It was very serendipitous in terms of kind of back to that piece of advice. I think for me, it was my head and my heart aligned, and that created a spark. However big or small my own experience with the pharmacy is, I deeply understand the friction that exists through my own personal experience. And I think that is always a wellspring of energy and a source of strength when things are inevitably difficult or different from how you thought they would be. It's like, no, I kind of know this is a problem fundamentally because I had this problem and I validated this like deep, as you said, in the fibers and fabric of your being. And then as I started digging into the industry, I was able to harness all of the things I learned as an investor. Right? How do I figure out if this is a good market? How does it work? What are the economics? What are all the players? All of those things that you have a really good grasp on before you start a business. And so when those two things combined for me, it felt like I got to do this. This is really the place where my head and my heart align.
Well, let's talk about what you are doing. And thank you for that, Eric. I had to ask the question. It's always fascinating when you see people that weren't, serial entrepreneurs in the first place. Like I said it earlier, I'll say it again. It is so needed and important right now to bring new minds into this space, to think differently, to think orthogonally. And the way you went at it, you saw it with your own personal experience. So I love, love, love that story. So Eric, hit us, my man. Give us to the community. What is Capsule?
Sure. Capsule is the simplest and easiest way for anyone to get and manage their medications. So what we've built out, we started with a blank sheet of paper and we said, if you built a modern pharmacy in 2015, what would that look like? And what are all the things that it should do for you? And our mental model for how we built the brand and how we built the product experience is centered around this idea that if there was one pharmacist in the world and there was one consumer in the world, and that pharmacist happened to be your mom, what would that engagement look like, right? And then how do we replicate that or build that through technology and through brand and through design? And so my mom would know what medications I take. My mom would know how to get coupons on my medication. My mom would coordinate with my doctor when I ran out. I would be able to text my mom about any questions I had about side effects at any time. My mom would know the price of the medication. And of course, she would bring it to my house. And so that's really has been the guiding principle for how we've built the product experience from the very, very beginning. And I think it served us really well in terms of making sure that we have a North Star that is incredibly human and it keeps us all grounded in terms of what we're trying to do and how we're trying to change the way people get and manage their medications on an ongoing basis. So that's kind of the consumer part of the business. And then we've also built out a number of tools for physicians, for other partners across the healthcare system with a set of externally exposable, configurable APIs. And then we're increasingly investing in things that help us actually drive or enable people that are taking risk to do that more successfully. And the pharmacy is a really big part of that. And we've built out a number of products on that side as well.
And so, Eric, of course, there's a lot of people that want healthcare status quo to stay healthcare status quo. And so you guys want to build something that is deserving of the times you are in. Who's being disintermediated? What's the disruption? Who are the ones that don't want to see these new models, these new ways of deliverance?
I'll speak specifically in pharmacy. The pharmacy industry has historically been dominated by a handful of large chain pharmacies, kind of conventional brick and mortar pharmacies. And then you've got grocery stores and mass market retailers have pharmacies, inside of them. And I think that consumer preference, I think two things have happened over the last 10 years. One, consumer preferences have shifted tremendously towards digital first, mobile first experiences, certainly within healthcare, but really in all parts of your life. Like you can pretty much do anything you need to do easily and frictionlessly on your phone. And then the second is I think the incentives in healthcare are finally starting to shift and come together around what I think most people would believe is the right model, which is that healthcare should get compensated based on the outcomes it drives, not the frequency or the volume of that happening. And so those two things are coming together in a really powerful way. And we've built the business from the very beginning to make sure that we're not only enabling those things, but we're actually driving, some of those changes for the industry.
And let's also talk physical locations. I'm here in Denver. You guys are here. We love having you in Colorado. It's wonderful. Actually, I was having a conversation with one of my colleagues here at Olive earlier today before the podcast recording that we're doing here. And he asked, what's going on for you later today? I said, I'm actually going to be interviewing Eric from Capsule. He's like, oh, I use Capsule in New York City. I love it. It's wonderful. So shameless plug. He absolutely loves it. But Eric, I got to ask, obviously you guys are scaling rapidly. What made some of those initial decisions, those ideal locations for Capsule? And then, of course, now current state, what are you looking for in physical communities to open up a physical location?
Our goal is to be able to serve as many people as possible across the entire US. And one of the things that we've learned is that having a high friction pharmacy experience as a consumer or as a physician is absolutely not specific to New York City. So that friction exists whether you live in New York or you live in Denver or you live in Austin or you live in LA or Minneapolis or anywhere else in the US. And so our goal is to be everywhere where we can serve people and help them have a better way to get and manage their medications. And we are pretty systematically opening up new more and more markets on a very regular basis across the US. And so this year we'll be in a position where we're able to serve about 100 million people through the geographic footprint we have. And the goal is to close the gap between 100 million and 320 million over the coming years.
Well, it's exciting. So give us a little also now future state, Eric, where do you see things heading? You already talked about it. People are definitely looking at ways how they engage with technology. We're getting there. There's so much we can do just with a smartphone in our own hand. Where do you see things heading, not just for the industry, but for Capsule as well? Take that out, 2 or 3 to 5 years. Where are things heading? What do we need to be mindful of, the community that's rallied around this podcast? What are you seeing from your captain's chair that we should be thinking about keeping top of mind, and where are things heading?
I think there's two things. So over time, one of the things that has been really surprising to me as a relatively fresh eyes into healthcare has been that there's a lot of companies in what I would call traditional consumer commerce or digital commerce that have built emotionally resonant brands in a lot of different categories: razors, luggage, eyewear, mattresses. And yet when I think about the full spectrum of healthcare, there isn't really this brand that not only you care about, but that cares about you. And I think there's such an incredible opportunity for Capsule, given that the pharmacy is, high frequent interaction, and given the pharmacy touches just about everybody at some point in the course of a year, to really be that trusted place for the consumer to solve a variety of problems within their healthcare journey. And those don't have to be things that we necessarily always build and own ourselves, but to bring together best-in-class partners across that entire spectrum of things that you may want to do and solve and manage in your healthcare life. And for Capsule to be that one-stop place where you can go do a variety of things, again, partnered with a bunch of different folks in a bunch of different categories. So that's one thing over, I wouldn't say 2 or 3 years, but over a longer time horizon, we're incredibly passionate about. And then the second is really around the pharmacy as an enabler to drive better healthcare outcomes across all sorts of variety of economic arrangements that are just starting to emerge in how that happens. And we've, I think, done a good job of investing today in the platform technologies that are going to enable that to happen over the next 2 to 3 years on that kind of time frame. So those are a couple of things that we're thinking about is really what's the role of pharmacy overall in the consumer's broader healthcare journey, but then also what's the role of pharmacy as a channel and ecosystem partner to help and support wide variety of organizations and insurance companies and providers to be more successful in the things they need to do.
Well, thank you for that, Eric. I appreciate kind of where you see things heading. I do also want to go back. I have a question that I want to ask in regards to, it's obvious that this is a great experience, for the consumer, right? That's evident. I've heard it from friends. I've seen it in my own community. But Eric, can you share a little bit? What's the feedback you and the team get from the other side of that aisle, right? You mentioned earlier your physician friends. You said, man, you imagine what it's like for you as a patient coming in, trying to get your prescriptions. Imagine it from our side. How has the experience been for all of them on the other side of this entire journey?
For our partners, such as doctors, and the feedback has been really incredibly positive over the life of the business. And the way that we even sort of knew to really start engaging with doctors in a more systematic manner, it happened organically. Like a lot of companies, you start out building your early customer base with your early evangelists. And it turned out that some of those early evangelists were physicians themselves, and they used it and they loved it. And they said, gosh, I should be recommending this to all of my patients. My patients deserve to have a better pharmacy. They almost felt guilty that they had discovered the secret they were using for themselves. They should be sharing it and recommending it with all of their patients. And so we continue to see a lot of love, not only from consumers, but from doctors. And we help doctors do a couple different things. But one is just to streamline their administrative burden. Doctors and their staff spend incredible amounts of time dealing with like myriad of high friction things with not just with the pharmacy, but specific, to the pharmacy here. And then, people are 50% more likely to actually get their medications when the prescription comes through Capsule. So doctors like that, right? They are prescribing you something presumably because they want you to take it. And for you to take it, you need to get it. And so by removing a lot of the friction around that overall end-to-end experience, whether it's around inventory, it's around price transparency, it's around just being able to get advice and understanding what's going on, we've been really be able to drive the fill rates that the people are getting their medications at, which is really exciting. And then that, that fact then, parlays, very directly into why insurers and other organizations that are on the hook for paying for things in people's healthcare are really excited to partner with us across it. So I'd say on the consumer experience side, everyone loves the consumer experience that we've built and that we can drive. And in a lot of instances, we actually drive NPS for our partners. So when we look at some of our partners who make Capsule available to their members, those members think more favorably of the partner organization because they've made it so easy to get into Capsule and use Capsule. And so that's kind of one. And then two is on the, on the healthcare outcomes piece. And so we love working with really forward-thinking organizations that understand that it's really important to reduce friction in healthcare because it enables people to consume it in a way that's going to keep them healthier and better.
Excellent. Well, thank you for sharing that, Eric. And then, of course, we want to be able to help you out. As you know, this is a very long journey for all of us to move healthcare forward. It's not going to happen overnight. But if we just keep moving one foot in front of the other and working together, I know we're going to get there. So with that, Eric, we have an amazing community rallied around this podcast. What's one problem, need, or question that you and the team have that we can be helping you with?
We are always looking for amazing talent to come join our team. That is, I think across all parts of our business, but on product, on business development partnerships, we're just seeing a lot of inbound demand from folks on that. And so I'd say if you're talented or talented people and you want to work somewhere with people who work hard but are solving interesting problems and complex problems, we love being introduced to those folks.
And of course, in order for our community to chime in and learn more about the company and yourself, where are some contact points online, social media handles, websites, or otherwise? How can the community get a hold of you guys?
Of course. Our website is capsule.com. Simple enough. And then our Twitter handle is @CapsuleCares.
Easy enough. And those contact points for our community will be in the episode notes. Just simply scroll down into your podcast player and click on through for those contact points that Eric just shared. Of course, they'll always be in our free global online community at passionatepioneers.com. Simply head over there. There will be a post for Eric's episode where you can also leave comments and feedback, as well as grab those contact points. Again, passionatepioneers.com. Well, Eric, this is a fascinating, fantastic, exciting conversation. I was geared up to spend some time with you and learn more and share the Capsule story with our community. But I have one more segment for you. We'll get you out of here. So fill in the blank. I'm a passionate pioneer because?
I'm a passionate pioneer because I'm incredibly excited to simplify healthcare for everyone.
That's what I'm talking about. I love it. Absolutely. Well, Eric, thank you again for taking some time to be with us today and sharing the Capsule story. Do keep us posted, and I know you'll be hearing from some of our community members as well. But for now, Eric, thank you again for being with us today.
Thanks for having me.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.